What's up, C Money fam? It's your boy C Money RN, and welcome to another edition of Nursing and Flow. In today's episode, we'll be discussing the signs and symptoms of stroke and what to do right after. Welcome to the episode. So guys, I want to bring it back and share a story that I experienced a couple of weeks ago. So a couple of weeks ago, it was right at shift change. I was getting a report from the night shift nurse when I happened to notice that the patient wasn't feeling right. The patient during the shift report was complaining of feeling weak, dizzy, and was saying that she had a hard time lifting up her arms. Right after that, the night shift nurse and we decided to ask the patient, have you felt like this before? And the patient said, no, this is the first time I felt this way. So our instincts told us we need to go ahead and check blood pressure and check blood sugar to see if maybe this dizziness and this complaints of weakness is related to either one of the two. So the night shift nurse, she went ahead and grabbed the vital sign machine, checked the blood pressure, and I got the AccuCheck machine and it was normal. Both the blood sugars and the blood pressure was normal. So the second thing that we wanted to ask was, we asked the patient, can you smile for us? And when the patient attempted to smile, we noticed that one side of the face was drooped and only one side was smiling at the time that it happened. So after that, I asked the patient, can you go ahead and try lifting up your arms for me? So the patient tried lifting up her arms, and I noticed that one side dropped quickly compared to the other. So I knew that something was up. The third question I asked was simple of questions. I wanted to have the patient talk to me, see if there's any slurring in speech, and oddly enough, there was some slurring in speech. Speech wasn't as clear as I thought it should, and that's when I knew that this patient may have a potential stroke. So what the night shift nurse and I did was we called the charge nurse, and the charge nurse agreed with us saying, you know what, we need to go ahead and call a rapid response. So in case you don't know, rapid response team includes a charge nurse, includes critical care nurses. Since I work on an IMC floor intermediate care, the whole unit is filled with critical care nurses. So I had a bunch of RNs on my unit to help get the vital signs, to help document what was going on in the situation. And we had a respiratory therapist involved, and we had our clinical supervisor involved as well. So with all these people in the same room, we determined that the patient was indeed showing signs and symptoms of stroke and was showing neurological deficits. At that time, my house supervisor knew it was time to call a code white. When that code white was called, additional people came to help as well. We ended up having an ICU charge nurse. We had our head stroke educator come into the room, and we knew that something was up at that time. And from that on, we ended up ordering a bunch of tests. We ordered a CAT scan, we ordered blood works, and the attending doctor at the time had us put in all these different orders to figure out whether or not this patient was having a stroke or not. So the purpose of this video, guys, is that I want to help you and educate you and have the resources so that when a stroke happens, you know exactly what to do and what you need to order. Looking back at that story, the first thing that I did was I asked about the face. I asked the patient to smile. And when it comes to strokes and strokes in general, you can do this at home, you can do this at the hospital setting. There's an acronym that's really effective. It's called FAST, and I want to share this with you guys. The acronym is called ACT F.A.S.T. And so the purpose of ACT F.A.S.T. is it lists all the symptoms that I listed in that story. And when it comes to the F for face, the A for arms, the S for speech, and T for time. And if we look at it, the face, it stands for, you have the patient smile. If the symmetry of the face is not equal, you know that they're having a symptom of a stroke. A, the arms, if you notice the patient is unable to lift their arms in an even way and one arm drops faster than the other, you know that's also a sign of a stroke. The speech, if the speech is slurred, and all three happened in my situation, and so I knew that right away, I had to act quickly. T for time, you have to call for help right away. When you're at home and you notice that a loved one is having signs and symptoms of stroke, you need to call 911 right away and get your loved one to the hospital as soon as possible so you have the necessary interventions conducted. The same thing applies as well as an RN. When you're on the hospital unit, you have a short period of time to get that patient down to get a CAT scan, and the purpose of that CAT scan is to determine whether or not there's a bleed. Sometimes people tend to think that a CAT scan will determine whether or not a patient has a stroke, but it doesn't. It just determines whether or not there is a bleed or hemorrhage. Which brings me to the next point. What are the different types of strokes? Well, there's 3 types of strokes involved. You have a ischemic stroke, you have a transient ischemic stroke, and you have a hemorrhagic stroke. So the ischemic stroke is when, think about it this way, the blood flow to your brain that carries the oxygen-rich blood, it is clogged off. And so since it is clogged off, you're not getting enough oxygen to the brain, therefore it gives you those signs and symptoms of feeling weak. One of the biggest things that you have to order in a hospital setting is something called TPA. In case you don't know, TPA stands for Tissue Plasminogen Activator. I know that's a mouthful. And evidence-based practice shows that if you take that particular medication within 3 hours of the first symptoms of an ischemic stroke, you'll have a lot of a better outcome for that patient, and it will reduce the amount of disabilities, and also it will improve the chances of the patient recovering fully. The second type of stroke is something called a transischemic attack, or TIA for short. In the hospital setting, we call this a mini stroke. And a mini stroke, think about the same way as an ischemic, but that blood flow, it is not clogged up for a long period of time. Typically, it is clogged up only for a short period of time, 5 minutes or less. And in that situation, it is important still that you need to act quickly. And while you're not using TPA, you still want to be able to get that patient to the hospital as soon as possible, because you want to get the right treatments, the right blood thinners, such as warfarin, Coumadin, whatever the doctor wants to order for that patient, heparin to say the least. And once you get that patient onto those particular sets of medications, from that point on, you could prevent future strokes from happening in the first place. The biggest thing about a TIA, a transischemic attack, is that if you don't treat it quickly, it can lead to a much worse stroke in the future. About 1/3 of people in the population don't recognize a TIA right away, and since they don't get the necessary help, a severe stroke happens to happen within 1 year's time. So it is important that you act quickly and that you get help from a healthcare professional right away. Last but not least is one of the most severe strokes, the hemorrhagic stroke. So the hemorrhagic stroke, as the name suggests, is a brain bleed. When the arteries in your brain, there's a rupture or leak, and that's caused by either a hypertension or aneurysm. When that happens, usually a CAT scan can help determine this, that if there is a bunch of blood accumulation in the brain, and you want to be able to treat that right away, especially because you don't want the patient to get even more worse as originally anticipated. So knowing that there's all these 3 different strokes, another thing that you have to do is call that code white. So that code white that I talked about includes different specialists, includes a ICU charge nurse, and from that point on, you need to get a bunch of steps conducted in a timely manner. One of the biggest tests is a CAT scan. That needs to be done within 45 minutes. The CAT scan, like I said again, it determines if there is a brain bleed going on in that situation. Second, you want to do something called an NIH Stroke Scale. That stands for National Institute of Health Stroke Scale. The Stroke Scale, to be exact, it is a test that helps determine the severity of a stroke. And so in a stroke scale, there's 11 questions total. The highest grade is 42. And some of the questions that you need to ask yourself is the patient awake, alert, and oriented? Is the patient able to answer simple questions such as what's their name and date of birth? You have to ask the patient the same questions such as lifting up their arm straight. And if you notice any drooping, you score a high grade. Same thing with the legs. If you notice that there is any unequal movements, if one leg drops faster than the other, that's also graded a high grade as well. And other things that you ask is you ask them to open their eyes quickly, and to clench their teeth, smile, and see if they can follow those simple commands. And if they're unable to follow simple commands, that is also a high grade for a stroke. And the higher number, like I said again, determines the severity of that stroke. You want to get those 2 things done quickly, as fast as possible. Upon results of that CAT scan, what's going to happen is you're going to have a on-call neurologist come in and help assess the situation. That neurologist is going to go ahead and put in orders for additional tests as necessary, such as a ultrasound of the carotid arteries, the arteries that are in your neck. They also may order additional tests such as blood works, put your patient on blood thinners. From that point on, when you get enough tests conducted, the neurologist is able to determine what type of stroke. Is it a hemorrhagic? Is it a ischemic? Or is it a TIA? And upon that, no matter what type of stroke it is, you're still going to conduct the same additional assessments. You're going to conduct the same additional test and get the same additional orders. You want to be able to conduct a bedside swallow exam. You got to make sure that your patient is able to swallow. If your patient is unable to, it is most likely due to the weakness that is caused by the stroke itself. And so that's why it's important. You got to see if they're able to take their meds whole, if they're able to drink water, and if they can't, you have to try again later. You don't want to force anything into them, or else it's going to cause them to choke and also lose breath very quickly. Very crucial. A second thing you also want to conduct is a depression scale. So when it comes to a depression scale, that depression scale you want to conduct because in a situation like as a stroke, you may oftentimes have patients that are feeling down in the dumps. They feel depressed, they don't feel like themselves. And if you get to determine that they have a high level of depression, you want to also be able to call the attending doctor right away and make sure that you get the necessary treatments, you get the necessary support groups to come in and talk to that patient, because you want to be able to reduce the risk of that patient harming himself or herself. Last and most importantly, one of the things that we need to do also is that since nursing is a team effort, we need to get a lot of therapy involved. In addition to speech therapy, who helps evaluate speech and helping them swallow, helping them eat their foods on a regular basis, you also want to be able to order physical therapy and occupational therapy. Because compared to from previous baseline to now, patients that undergone stroke, they may have some minor disabilities or severe disabilities. They may not be able to perform regular acts of daily activities such as brushing their teeth, taking a shower, washing their face as effectively as they've done before. So it's important that we get a head start on these therapies so we can get them harder, better, faster, stronger, shout out to Daft Punk, and so we can get them out of the hospital quicker and in a timely manner so they can start being home, happy, back with their families, and start doing additional treatments and therapy. In addition to rehab, in addition to assessments, lots of education is very vital. You want to be able to educate that patient. What are the signs and symptoms of stroke? So the next time it were to occur, what are some things to be looking out after? You also want to educate them on medications. What sort of medicines do I need to be taking, for instance? How do I take them? What are the side effects? All of this is crucial and to include the patient into the care team. At the end of the discharge, when the patient gets out of there, you want to make sure that the patient is adhering to all these lessons. You want to incorporate readbacks. You want to have the patient explain this information back to you to ensure that there is an understanding involved. And so that way, the percentage of recovery will be a lot higher, and also the percent of knowledge will be a lot higher. So in a future episode, guys, I will be discussing more along the lines of the rehab and therapy at home. I'll be giving some tips and tricks on what to do with loved ones who have undergone a stroke, because I had a loved one a couple weeks ago that had a big, massive stroke, and she's actually doing okay right now because of the help and support of all these healthcare professionals and family and loved ones. Hope you guys enjoy that episode of Nursing and Flow. If you haven't yet, please subscribe to this channel, hit that like button, leave a comment below, and I hope you guys enjoy the future content that I'll provide for you. Thanks, guys. Take care.
Busting through the bears that try to contain me. Moving on up, making moves and money endlessly. How you think I got this name? C Money, it's my specialty.